and Kurt for a very informative talk and for providing low vision services to our veterans. Our next speaker is our colleague, Dr. Stephen Sauer, an associate professor here at UW-Madison. He will be talking about the aging of the eye.
Thank you, Mihai. I'd first like to just take a moment and thank the organizers, Dr. Blody, Dr. Milieu, and all of the support staff that have pulled this event together. It's an important service to the community. There's a lot of details that are required to make this thing happen. And so I'm glad to be a part of it. My name is Steve Sauer. I'm a comprehensive ophthalmologist at the University of Wisconsin. I've been in practice for about 15 years, and I've been here at this symposium in the past, and I think it's a wonderful event. I'm glad you're here, and I hope that what I offer you is going to be something useful that you can walk away from. I've broken my talk down into essentially two parts. We're going to talk about the aging eye, and this is an opportunity for us. While the focus of this seminar is on macular degeneration, naturally the question can arise, well, what about these other things that are going on around my eye or in my eye? And I'd like to have the opportunity to talk about some of that. First, I'd like to say that there's a spectrum of things that happen just like with any other part of the body that can be considered normal. With observation or very mild or conservative interventions, these things can be managed quite well. So it's important to realize that most people as they get older have good vision. And so if there's a change in your vision, that is something that you would want to get checked out. Some of these changes can be quite natural. For example, if you're having more trouble reading, it might mean that you just simply need a stronger pair of reading glasses. This is presbyopia. It's a natural change in your vision, but it can be managed conservatively and it's not a problem. So reading glasses are quite a normal part of getting older. It's also important to realize that things wear out. We all know that. And so the eyes can be irritated because the amount of moisture that covers the surface of the eye, the glands, the tear glands, just might not be working as well as they used to. And so using eye drops to help manage irritation of the eyes can be something that can be quite helpful. It's also important to realize that the tissue around the eyes can change. People can get baggy skin over the eyes. Their eyelids can droop a little bit. And most of the time, these are minor changes. They're just an inconvenience, and they don't need to be addressed. However, these are things that can be addressed if they become sufficiently bothersome or if they actually cover the line of sight and become an impairment to your vision. So many aging changes are normal, they can be managed, and if they get to be a problem, they can be addressed. I think that it's important then to move into a different part of my talk, which is that there are a couple of things that might be changes in the eye that really do need to have some sort of medical or surgical intervention. The big three, we kind of talk about that, glaucoma, cataract, and macular degeneration. And I'm going to talk about each one of these in turn, but these are things that begin to emerge in the 60s and 70s and 80s that generally affect people's vision and do require some sort of medical or surgical intervention. This is a picture of what it might look like for someone who has glaucoma. This is particularly important with this seminar because macular degeneration tends to affect the center vision, whereas glaucoma tends to affect the peripheral vision, at least for the most of the disease. And so this is something that center vision is something that people will notice a change in very often, but glaucoma can be insidious and it can creep in, and people may not know that they have it because it starts from the side and comes toward the center. But particularly important in this group because if someone is suffering from macular degeneration, it's very important to preserve the peripheral vision and make sure that that part of the visual field is, maintains its integrity. And so this is something that's done at the eye doctor or the optometrist. An eye pressure test is typically part of an annual exam. And so the recommendations are that Certainly when you turn 65, you should begin to get your eyes examined at least once a year or perhaps once every other year, just to do some screening for any kind of pressure problem in the eye that just might not be apparent. Because glaucoma is something that you wouldn't know that you have it. It's a bit like high blood pressure. You may have it for years and not know it. And so it's important to get an eye exam periodically just to check for this, this particular problem. This next slide shows a picture of what it might look like for someone who's got a cataract. You can see that it's kind of a bit like looking through a frosty window on a cold day. And you've got this foggy, unclear, kind of grainy image. And this is a very gradual process for people. Cataracts usually take many years to develop, but certainly this is something that can affect people's vision, and it's something that can be corrected surgically. It's the most common procedure reimbursed by Medicare, and it has an extraordinarily high success rate, about 98% chance of success. So the cataract is simply the cloudiness of the natural lens. This is a picture that shows the natural lens inside the eye, and instead of being clear when we're 18 or 20 or middle ages, it begins to get cloudy. And I just thought it would be interesting to show that there are lots of different kinds of cataracts. The first slide on the top left shows a mature cataract. It's completely white. The slide on the right shows a typical age-related cataract. It's like the peanut on the M&M. The center of the cataract becomes yellow or brown or cloudy. And then the bottom left shows just a different kind of cataract. My point here is just to say that there are lots of different kinds of cataract, and they can affect the vision, but all of these can be removed surgically. And what we do in that procedure is that we replace the cataract with a clear implant. It's about the size of a button on a men's shirt, and it's a picture here on the index finger to illustrate the size of the lens, the implant. And this is what we put inside the eye when we take out the cloudy lens, the cataract. And this restores the focusing power of the eye so that people can regain their vision. I know a lot has been said about macular degeneration, but I'll include that here, just a few words to say that these two pictures illustrate what might be some initial symptoms from a patient point of view if they're experiencing macular degeneration. They're looking at the newspaper. The picture on the left shows just a little bit of a central smudge. Everything around that central point seems to be rather clear, but there's a blur, a bit like Vaseline or something in the center smudge there. And the slide on the right shows that there's a little bit of wavy, gravy, squiggliness to a portion of that picture. And typically we ask patients, if you look at a telephone pole or a door frame or some sort of vertically oriented object, do you see any wavy, gravy, S-shaped, squiggly lines? And that could be a sign that there's something wrong with the retina that could indicate that there's a macular degeneration problem. The way we test for this in the clinic is that we'll give patients an Amsler Grid. It's basically a piece of graph paper, and if there's any focal or localized areas of blotchiness or waviness, then that could be a sign that there's a macular degeneration problem. Just a picture of the retina. The macula is a very specific part of the retina which is responsible for the central vision. It's actually quite a small part relative to the entire area of the retina, and it's important to circle back around to my first disease process that I talked about, the glaucoma, because the center vision might be affected, but the rest of the retina, it's important to keep that healthy. There are two types. There's the dry type, which is the most common, and the wet type, which tends to occur much faster and can be much more devastating in terms of how rapidly and the extent of vision loss. We've heard, I'm coming on the tails of some really good talks on some low vision aids, but I just thought I would put this in there to illustrate once again that there are lots of assistive devices out there for people to help them maximize their vision. That's all I have for you today, but I do think that we have an opportunity for some questions, and I think that this is an opportunity for the other presenters to come up and field some questions.